if we look at the wastewater surveillance across the province, it's pretty clear that those are headed in the upward direction in many parts of the province. And, because we're not doing widespread PCR or testing throughout Ontario and then actually in most parts of Canada, you have to look at other indicators. And wastewater is certainly a very good one and an early indicator. I think it's also fair to say that, in addition to that, there just seems to be a lot more COVID. Now, that's not data, that's anecdata, but the wastewater is good data. And it's sadly, we should be looking at lagging indicators, which are things like hospitalizations. And I think no one would be surprised if in a few days or a week or so, you might see a bump in hospitalization. There's more COVID now than there is a week or two ago. The real question here is, how big will this wave be? Not, is there a wave? How big will this be and how significant will this impact us in Ontario and elsewhere in Canada? I don't think it's going to be as big as the wave we just had, but again, it's going to be something. There's still COVID out there. Let's keep our masks on and get vaccinated.
Okay, you raised a number of things I want to get to. If it's anecdata at this point in Ontario, we do have some hard numbers out of Quebec. Hospitalizations are at their highest level in Quebec in more than 2 weeks. Number of healthcare workers who are off sick with COVID, that is jumping as well. And from the interim public health director, Dr. Boileau, he said we're not officially in a sixth wave in Quebec, but it looks like one because the cases are moving up. So he's seeing some of the things that you're just pointing to as well. Is this the effect of BA2? Is this what's happening?
Yeah, it looks like BA2 is going to be driving this. And the samples that have been collected, we certainly can do what's called genetic sequencing on those. And yeah, there's just more BA2 now than there was a while ago. It's more transmissible than BA1. Remember, this is all under the Omicron umbrella. It's all Omicron. But BA2 certainly is more transmissible. Important to remember, though, the vaccines work just the same for BA2 as they do for BA1. This clinical spectrum of BA2 seems to be identical to that of BA1, at least based on everything we know today. It's just more transmissible. But of course, we've seen this before with the Alpha variant, with the Delta variant, with the BA1 Omicron. If you have a more transmissible variant, it's just going to spread more quickly. It'll take over and be the dominant variant in a matter of time, and it certainly can cause a wave. So I think we're going to have. It's not. I think we're having one. It's
right.
just not extent. It's not clear to what extent, how big this will be, and how significantly it will impact us here in Canada, including our healthcare system.
Yeah, what degree of strain it'll place on the healthcare system, that is to be determined. So you mentioned a couple of things. Masking. Here we are timing-wise when the numbers are on the upswing again, and mask mandates in the vast number of public places basically across the country are now lifted. What do people do? And especially, not just adults, but children at school.
Right. I know this is always a topic of debate, and sometimes this is a very heated topic of debate amongst people. I think it's fair to say that masks, of course, aren't perfect. It's not a force field, but they do help, and they do protect the individual wearing the mask from getting an infection, and they lower the risk. They don't eliminate the risk, they just lower the risk. Similar, they create a safer indoor space for everyone around you as well. I think given the amount of COVID that we have in the country at this point, it's still a very, very good idea to keep our masks on in indoor settings. I'm doing it. There will be a time where I think that obviously we shouldn't be doing this, or we don't have to be doing this, but we're not there yet. And certainly with an upswing in cases, I think it's a very good idea to keep those masks on for now.
And one of the other factors why some think this might not cause the same strain on the system as previous variants have is because of the level of vaccination. But I was mentioning Quebec, again, offering fourth doses to an expanded part of the population as of today. What is your latest thinking on vaccination and whether more and more of us are going to be getting fourth doses very soon?
Yeah, it's interesting. In Ontario, there's been a fourth dose program for some time, and fourth doses have been offered to those who reside in long-term care facilities and in those with underlying medical conditions and people whose immune systems aren't functioning as strongly as they could be. Now, I wouldn't be surprised if we start to see an expansion of that fourth dose program to community dwelling populations that are over a particular age cutoff. Where that age cutoff is, I'm not sure, but there's emerging data that an additional dose might be very helpful for older populations. The UK, for example, looks like they're going to give it to people over the age of 75. We hear some chatter in the US about might be 50. Some places might be 80. I think we can all look at the data and come up with different conclusions. But it does appear that with waning immunity of the vaccine and with time, that a fourth dose may provide certain populations, not everybody, but certain populations, with some additional benefit and additional protection. So we'll probably hear more of that from our federal public health leaders in the days ahead.